conversation, and I'll put up slides in just a brief second. But excited about this because my dad is actually raised in Zionsville, Pennsylvania, near Allentown. We actually have one of our largest anti-stigma efforts taking place in Pennsylvania. So it's really been the nexus of a lot of our anti-stigma work, and I think it's something that the state and a lot of our key kind of recovery community organizations and key partners in the state have really prioritized. So just really happy to be here and be able to kind of share some thoughts on stigma, more broadly. So I'm gonna walk through some slides very quickly and just sort of share a little bit about Shatterproof, but also a little bit about why we think stigma is such an important piece to addressing the opioid epidemic. And as we kind of go through the conversation, I'll try to touch on places where I think individual folks and organizations can step up in this way, because we're really firm believers that this is one of the key areas where organizations need to think about and confront the addiction epidemic in their community. So a little bit of background on Shatterproof. Shatterproof is a national nonprofit. We've been operating in the space for a little under 10 years, so we're fairly young in the space. Without getting into details, we have really three priority areas: improving and revolutionizing the treatment system, addiction stigma, which we'll talk about today, and supporting and empowering our communities, predominantly and primarily through family-based education, but there are other mechanisms where we do that work. And one of the questions that we most often get, or where we often get, is, we know stigma is important. We think it's something that we should pay attention to, but why is it one of your three main pillars? Like, why isn't it prevention or some other kind of components? And we really do believe that stigma is one of the most important factors to address. And I always point people to this slide and this information. So when Shatterproof as an organization looked at the key drivers of the opioid epidemic nationally, we came to a list of 9. And I think you could make this list 8 or 10. I mean, you could slice it in different ways. We chose 9 key drivers, and out of those 9, 7 of those 9, we believe are either partially or entirely driven by pervasive stigma, right? So things like the increased access to fentanyl and all of the marketing related to prescription opioids, those happen sort of pre the stigma of substance use disorders. But things like shame and social isolation that people feel when they have a substance use disorder, or people not seeking help, or not having appropriate treatment capacity because doctors don't prioritize or want to treat this disorder, those are certainly caused or addressed by stigma. So you can kind of see why we start to see this as a real problem in the space. Unfortunately, we haven't seen a national response around stigma. We've seen a lot of national efforts related to naloxone, and a lot of national efforts related to curbing overprescribing, and those are all critically important. But per the slide that we just talked about, we also think that addressing stigma should be on that same level and deserves a national response. So we started to look at that question, right? We knew a lot of people had done versions of stigma campaigns, right? They had printed out some posters and put them up in the office. They maybe invested in billboards that they put across the state, maybe funded a local art display that showed pictures. But what we didn't see was a lot of rigor and what we would call kind of a traditional public health intervention, right? So we looked at a lot of other social change movements, things like mental health, or smoking, or gender equality. And we looked at those social movements to try to say they've made measurable progress in the last 20 or 30 years. What was it about those campaigns that were so effective? And can we apply that in the context of addiction? Ultimately, we came to the conclusion that we could, and we thought it was really important in that work to actually break down what we mean by stigma. And I think this is super important to think about when you're thinking about individually what you can do to address it. So I think most people, when they think about stigma or they think about discrimination as it relates to people who have a substance use disorder or who have an addiction to opioids, they think about public stigma, right? The community not treating that person particularly well, or their family not treating them well. And that's critically important. And that's certainly a problem. But we see other forms of stigma, right? So structurally, right, it is more difficult for people with a substance use disorder to seek certain forms of healthcare compared to other chronic medical illnesses like diabetes. There's more stigma associated within that, within employers and within healthcare providers. And then, of course, you have really serious self stigma, right? So if you tell someone over and over again that they're not worthy of being in someone's family or not worthy of being in someone's neighbor, someone's neighbor, that starts to get internalized to the point where even if you address public stigma, if you're not also uplifting those individuals as well, you haven't actually, curbed a lot of the major causes of the problem. So what did we find when we did this research, right? What were important factors in previous movements? We found 6 that we thought were really critical. So the first, the fourth, the fifth, and the sixth are really about how you do movement building, right? You want to have a team at the center who's all, they all have the same playbook and they're all playing by the same rules and they're doing everything externally in the same way. And 4 through 6 are really about how do you create change, right? What influential institutions, state governments, large funders do you want to work with first? How do you set up positive and negative incentives, right? When people make good change, how do you recognize and reward that? And then when people are saying negative things, right? If they use the word addict, how do you make sure that you're actually, applying some negative pressure so that people don't continue to use that language? And then, of course, it's critically important to be having conversations at the grassroots, right, with individuals who are trying to make individual changes, as it is to be talking with the federal government about how they can be funding more of this work. Getting to 2 and 3 specifically, I think these are really interesting because they relate to what organizations can do and how organizations can make change. So first is education. You have to get rid of the myths related to substance use disorder, right? If people continue to think that it's because someone doesn't have the willpower to just quit the thing or to quit the stuff, if people believe that, it makes changing language and changing policies really difficult. So you need to educate. Language is really, really important. And I think people underestimate the importance of language. We know that not only does language make people feel bad, but actually from an evidence-based standpoint, if you call someone a junkie or if you call someone an addict, that actually leads them to getting worse treatment in the healthcare system. It leads them to getting worse treatment from their friends and family. And these are all things that further structural stigma. They're all things that further self-stigma. And then, of course, related to what I was saying earlier about structural stigma, changing policies is important. So, it's one thing to educate people and talk to them in a different way, but if you're not actually changing how their employer is treating them, or if you're not actually changing how the healthcare system is treating them, they're still going to run into barriers that make getting care really difficult. As it relates to education, this is our third point. You have to educate in a certain way. It's not just let's have somebody talk about how they're in recovery and leave it at that. You actually need to use specific messages, right? You need to humanize the disease. You need to talk about how treatment's effective. There are certain phrases and terms that we know actively reduce stigma, and there are other phrases and terms that we know actively increase stigma. And so if you're just doing education for the sake of education and you're not actually using the right terminology and verbiage, you'll run into issues. So this is just in a little bit more detail, some of the specifics of what we think need to be done, right? Sharing stories. Shatterproof has an educational module called Just 5 that works on some of those myths. Changing language. I would definitely recommend people look at shatterproof.org. We have a free language guide, free video resources related to language, free social media graphics that you can use throughout your company. And then, of course, policy, right? We think there are critical benefits and policy changes that every organization should make. I'd also recommend people check out our white paper. This is also on our website. It goes into a lot of this information in much greater detail, but also gives a lot of tactical insight and advice on what individuals can do. And then, of course, we're working across a lot of stakeholder systems. I think one of the other places where people who try to work on stigma, fail or kind of fall apart is they focus on one. They think about the general public or they think about the local community, but they're not thinking about what employers need to do to change. They're not thinking about how healthcare organizations need to change. So we have specific strategies and approaches that we're developing across all of these systems. And because we're working across all of these systems, we have to work with a lot of different partners. And so we're really proud of the organizations that have stepped up, including the state of Pennsylvania, as well as other national partners, right? Like the American Hospital Association, the National Safety Council, who does a lot of work with employers around opioids in the workplace. They've been a great partner. So we're really, proud of the group of organizations that we've brought together, and think it's such a critical place for organizations to work on this topic. So I'll stop there and really just appreciate everyone taking the time. Like I said, Pennsylvania is a state that's super ahead on this topic, or at least they're really investing a lot of resources in terms of addressing stigma. So if you're ever interested in getting involved in the campaign or being a part of it, please don't hesitate to reach us at endstigma@shatterproof.org. And we're happy to get you involved in all the work we're doing in Pennsylvania.